The release of a report into last year's disappearance and death of Waikato man Nicky Stevens has found the police and the Waikato DHB failed the young man in his darkest hour. It's also reignited the conversation about funding for our mental health services. From Changing Minds, a non-profit organisation focusing on mental health, we're joined this morning by Kieran Moorhead. Good morning to you, Kieran.
Good morning.
This case of an awful case of Nicky Stevens has highlighted major failings in the way his case was dealt with. But do you think that's isolated or is it more systemic?
Well, I think the findings of the report into the DHBs found that in the specific incidents of the Waikato DHB was staff shortages, and but on a broader sense it was for all the other DHBs was a lack of family input and a patients integrated care model. So I think that that there needs to be a better look at how we integrate the concerns of the family with patients being treated at various DHBs.
From what you hear from the people you deal with, does that happen in other places where the families aren't necessarily brought into the equation, and are staff shortages a problem elsewhere?
I think each DHB faces its unique challenges based on the population it serves. Like, for example, Tairāwhiti DHB has a high Māori population, so there's the problems that they face can be quite different than, for example, Otago, which has a sort of rural area. And so getting family in to see people is difficult because they've got to come from so far away because it's such a huge area.
From the statistics I've been looking at, there is a spike in the number of people seeking or requiring mental health services. Is there the resources to respond to that need?
Yeah, so demand for mental health services has gone up 21% over 5 years, and the funding of mental health services hasn't kept up with that demand at all, and each DHB has a different amount of allocated funding for mental health services based on the population. So there's always going to be not enough, really, but it's a matter of how we can kind of use the funding that we have better, and I think that's kind of the focus of the government at the moment.
What are the consequences, though, of having that 21% spike of people saying, hey, I need help, and then not potentially being the help for them because of resourcing?
Well, that's what we know from these incidences, that when mental health services fail, they fail spectacularly, and it's really, really unfortunate that you always have to balance people's liberties and patient liberties and rights with safety of people, family and the public.
Speaking of liberties, I know that Waikato Henry Bennett Centre is now closing down because they're saying that they couldn't guarantee the safety of patients and the public. And I just wonder, where is the line in how secure facilities like this should be? I mean, I guess patients don't want to feel like prisoners, but there does need to be a security for them and for the public. Yeah,
I mean, first and foremost, it isn't a prison, so you've always got to keep that in mind. But secondly, I don't think Henry Bennett's closing down per se. I know it's going through a tender process of being more community-based, which is, I guess, a really good finding of their report, was to, have the community included more in the treatment of patients so that they feel a part of the community. So having it kind of more disestablished and community-based I think is a really good idea.
Well, here's hoping that those changes result in never having to see a case like this one again. Thank you so much for your time, Kieran Moorhead from Changing Minds.